Good afternoon, everybody. We'll begin in 1 minute. We're gonna let some of the people who are arriving settle into the Zoom room. Excellent. I think we have critical mass to begin. Good afternoon. My name is Miguel Angel Vasquez. I'm the Health Equity Urban and Regional Planner for the Riverside University Health System Public Health. And I'm also one of the leads of Planners for Health California, and I'm also involved with Planners for Health Inland Empire section. I am very pleased to welcome you to this amazing webinar in which we are going to be exploring a topic that is absolutely essential for planners to know about in terms of addressing one of the leading causes of chronic diseases and early death, which has to do with air quality. And to guide us for this presentation today, we have two amazing speakers who will share with you their work related to tobacco control policy in planning. So to do that, we are going to hear first from Nabiha Saeed, who is one of the newest members here at the Riverside University Health System Public Health, where she is serving as one of the project leads for our tobacco control program. Nabiha also just graduated from Concordia University with a Master's of Public Health. And along those lines, while she was working on her master's degree, she also served as a Civic Spark Fellow here in our department. And then we will hear from Amber Weir. Amber is the project director for NorCal for Health, a project of the California Health Collaborative. She has worked in the policy and public health field for about 7 years. Prior to that, she was a business advisor for the Small Business Development Center for 13 years. With her experience, she has been working on building collaboration with economic leaders in community development to support tobacco prevention policies. And she has seen much success as a result of her efforts. And with that, I'm going to just go ahead and turn it over to Nabiha to start the webinar. Nabiha, you are on.
Thank you so much, Miguel. So as Miguel just introduced me, my name is Nabiha. I am a team member of the Tobacco Control Project for our UHS Public Health. And today I'm going to be presenting on planning for clean air, which is the intersection of planning and public health regarding applications for tobacco policies within general plan frameworks. So some table of contents for today. Next slide. Next slide.
Clicking on this. There you go. Okay, I got it.
Thank you. So as a brief overview of today, we're going to be providing a quick introduction where I'm going to be setting the scene and providing some context. Then I'm going to be talking a little bit about, sorry, if you could go back one more. If you could, so perfect. Thank you. I'm going to be talking a little bit about the timing of everything and why right now is the perfect time for this collaboration, and then go into actionable steps for what planners can do, as well as what public health professionals and tobacco prevention advocates can do. And then we're going to be hearing from Amber, who will be sharing an example of what it actually looks like in action and the experience of implementing this in a rural community, and be wrapping up with discussion about the Tobacco Control Project in Riverside as an applied example of this strategy. Next slide, please. So I wanted to include some learning objectives and key takeaways from today's presentation. So after today, attendees should be able to describe the role a planner has within tobacco control frameworks, identify actionable steps a planner can take to integrate tobacco prevention within their scope of work, and extracting applications for local tobacco prevention frameworks. But before we get started, I wanted to ask to launch a quick poll that is asking, it should be popping up on your screen shortly. It asks, how much do you know about the built environment's relationship with tobacco use, with 1 being nothing and 5 being a lot? Hi, I don't know if I disappeared or if I'm still here. Can you hear
You're
me?
you're there. We can
Okay,
end the poll now. The results are shared.
thank you so much. I had a technical difficulty.
Would you
Right.
like me to read the results?
Yeah, if you could, please.
Okay, so out of all the attendees, we have 22% that say they know very little of the topic, 22%, well, I'm sorry, 22% is very little, another 22% they know a little bit, 44% know some, and 11% know a lot.
Perfect. Okay, thank you so much. And the next slide, please. Okay, so thank you for everyone who filled that out. Before we get started, I wanted to give a really high-level overview of what planning is for anyone who is in the room, because we do have some mixed folks in here who do not know what a planner is, and give a brief introduction for general plans and what that looks like. So next slide, please. So for those who are not of a planning background, I wanted to quickly go over a very abbreviated job description of an urban or regional planner. For the purposes of this presentation, we are referencing a planner as someone who is an employee of a local, regional, or state government agency who engages in the planning, design, or regulation of one or more elements of their communities, or a private consultant or researcher who supports that work. So specifically, someone who is tasked with envisioning a community's future needs, such as for land use, infrastructure, or developmental opportunities. Next slide, please. And then what is a general plan? So in order to accomplish this, a planner of this type is often involved with the development of a general plan or a policy document for the given community or jurisdiction, and it's updated every decade or so. And within the general plan, there are required elements that are to be updated more. Oh, we could go back. There are elements that are going to be updated more frequently than the full general plan update, such as housing, land use, and environmental justice. And the communities that are designated as priority areas also have an additional requirement for environmental justice sections as well. There has been a popularity in introducing an optional health element, and this is a great opportunity to naturally inject tobacco prevention frameworks within general plan policies. But as we'll begin to see, there are opportunities to allude to tobacco prevention and ultimately work towards tobacco endgame in the long run in all elements of the general plan. Next slide, please. So I kind of wanted to just paint a picture of what this might look like in real time. So in addressing a food desert in a rural area, a planner may be involved with designating spaces for grocery stores, corner stores, or markets to help provide food for a community without accessibility. So the small business that opened now applies for a tobacco retail license and is approved to sell tobacco in this isolated community. If you could click the next arrow twice, Miguel. Perfect. Coincidentally, the store is also located within close proximity of an elementary school with a primarily Latinx youth population. One more time. Perfect. And so those kids now pass the store with tobacco advertising plastered all over it on their way home and are enticed by the pictures and lifestyle marketed to them by the tobacco industry. They represent an intersection of multiple risk factors for tobacco use initiation by being BIPOC youth in a rural area and are at an increased likelihood of developing a nicotine addiction at a young age that then grips them for life. In a parallel situation, if the general plan for that area had a policy that regulated the tobacco retailer proximity to places that are frequented by youth, like schools or youth organizations, ideally the store would not have been able to obtain the license to sell tobacco, and that would have further protected a demographic that have been designated targets for tobacco industries already for decades. So in this example, the planner's role was more from a prevention, and it was indirectly responsible for protection of the youth. And although this seems to be a partial factor at face value, the proximity to tobacco retailers is actually a large predictor of smoking rates within a community. And so in limiting the accessibility to tobacco, but increasing the availability for nutritious options and other healthier options in a rural community, the planner took equitable considerations into account when designing the community and doubled the positive impact they had the intention of creating, rather than inadvertently kind of being part of the process of causing harm to the community that they were intending to aid and resolve this problem for. Next slide, please. And so I wanted to also go over some of the history with the tobacco industry and some ad campaigns that we've seen and their strategy for their marketing. So it's always been about promoting social behaviors that are associated with tobacco use and marketing, especially to racial minorities. So on the left, you'll see an ad campaign for the brand Cool and Newport that were primarily targeted towards African Americans. And they featured Black people in their campaign to entice other Black folks to also engage in smoking behaviors and affiliate the brand to their culture. And so in trying to become a cultural token associated with being Black and having that media representation, the natural psychological implication is to relate the content to a personal level. And so this was strategic to incorporate tobacco use within the culture of African Americans who were already facing large stressors with discrimination and widespread divestments in communities of primarily Black folks. So those stressors provided an opportunity to introduce cigarettes and menthols as a coping mechanism instead of investing in proper support and resources like mental health care and accessibility to providers. On the right is the brand Natural American Spirit. That is a commercial tobacco brand. The choice is to brand this with the logo of an indigenous individual and using the specific words Natural American Spirit were intentional. And they were chosen to market towards the indigenous and Native American folks. And I wanted to indicate that there's a very marked distinction between the tobacco programs that are in use in the state of California and the use of indigenous tobacco in cultural practices. So it's an entirely different substance, and the commercial tobacco is what we are talking about in a campaigning effort to protect communities. And so knowingly taking the cultural ties to tobacco that some indigenous folks have, but introducing it as commercial with the added toxins and commercialization, branding it as natural and eco-friendly choices with earth-friendly packaging. Not only is it blatant appropriation of indigenous culture, but it's also targeting the same people to engage in a knowingly dangerous behavior in commercial tobacco use by affiliating it with cultural practices, which are entirely different. So similar to the Cool and Newport strategy, aligning themselves with Black culture in America. And so when divesting in social infrastructures and declining to provide that support, and instead providing unhealthy alternatives to deal with the consequences of the said divestment. This is a stress coping mechanism with a severe threat of addiction that's been introduced into these circles and is now capitalizing on the suffering that they had a hand in creating. So it's cyclical, and this is a really, really difficult cycle to break. And I also wanted to show an ad campaign from today. If you go next, one more. This is an ad campaign for today, and currently one of the biggest issues we are facing in tobacco prevention frameworks is the use of flavored tobacco and the implementation of tobacco retailers. So in actuality, flavored tobacco is banned, but the implementation of an enforcement of that ban is very difficult to kind of consistently apply across the state. So that this is something that we're seeing is really impacting our youth and is now hooking a generation that has been told their entire lives to stay away from cigarettes, stay away from tobacco. But when it's flavored tobacco, when it's tobacco that is in alternative forms, so not in the form of cigarettes, it might be Zyn, it might be, alternative forms of heated tobacco. There are a lot of different ways that they are trying to create a new generation of youth who are addicted, and then they have customers for life and will continue to have those spaces in cultural populations that they shouldn't be in and shouldn't be targeting to begin with. Next slide. And so kind of to combat that, the rigorous campaigns from the tobacco control programs of California were made possible by the props that the state passed that allowed a percentage of the taxation on cigarette and tobacco products to go towards the funding for anti-tobacco campaigns. So all of this was made possible by funding. And without the infrastructure for funding, a lot of this is very difficult to do. Next. And today, the Undo campaign is the latest ongoing effort to undo the impacts that commercial tobacco has had on communities that have historically been targeted. So they feature very emotional messaging like the one on the right, that the deadliest industry is your friend, to allude to the fact that this is a really serious problem that our children, youth, and our communities are facing today. And they are ultimately working towards eliminating the sale of commercial tobacco and the presence of commercial tobacco within California altogether, which is a strategy that has also been adopted by Sweden, Australia, and a variety of other countries as well. Next slide, please. So I kind of wanted to talk about the CTPP's historical success and kind of where we go from here, and then that'll allude to the role that planners play. So these rigorous campaigns, as we've seen, have had a marked decrease in the per capita cigarette consumption and tobacco use within the state of California at a steeper decline than the declines we've seen nationally. I also wanted to highlight that on the right is a Surgeon General's report that was released this week. The first Surgeon General's report that referred to smoking as a causative link between disease outcomes was released in 1964, but there have been many reports released since then that continue to raise awareness and bring up the fact that commercial tobacco has a really strong presence in our communities. And the one that was released earlier this week alludes to the issue that tobacco-related disease and death is seen in higher proportions in communities of color and communities that are primarily of a lower income or lower socioeconomic status. It is more commonly seen in certain industries, those with certain occupations that may earn lower incomes. So there is a definite issue in terms of the prevalence between populations and the disparities that we see. And I wanted to kind of use that to segue into how exactly that pertains to planning and what that's going to do today. So timing is everything, and the COVID-19 pandemic really showed us that. And as a result, some trends, next slide, please. Some trends that we noticed in the analysis of COVID-19 infections and mortality included disparities in infection prevalence and post-infection outcomes, access to healthcare issues, and the resources that were inaccessible for vulnerable populations only further impacted them with disease outcome and further perpetuations of the same cycle that we were trying to repair to begin with. I also wanted to highlight that there are positive outcomes from COVID-19 that are really, they're not at the surface level and are not usually part of the discussion in discussing a post-pandemic world. But I wanted to highlight that post-pandemic, we actually saw a rise in the ability to find innovative mechanisms for social cohesion. So our social circles really came together, especially during lockdown and pandemics, and provided alternative mechanisms to be able to meet and have social interactions, such as Zoom. Zoom was a major outcome of the pandemic that boomed after the lockdown orders were put into place to keep up that social interactions. And we saw the use of alternative means of communication and connection, and this led to increases in volunteer programs as well. So there have been some positive outcomes that can be leveraged as well, and it's important to kind of look at both sides, so you don't have this kind of negative feel of despair and hope post-pandemic that a lot of us, especially in public health, might feel. So next slide, please. So chronic diseases were also associated as a predictor for COVID-19 outcomes. So obesity, diabetes, and heart disease that can all be linked back to an individual's built environment and access to healthy food, tobacco, and exercise opportunities. I also wanted to mention that e-cigarette use was a predictor of poor COVID outcomes in all age brackets. So that's the kind of link to tobacco in today's day and age. And so this begs the question that why did the structures that are currently in place within our society make COVID's adverse outcome disproportionately impact some more than others? And so planners should be addressing that within their work while establishing the built environment. Next slide, please. So this is a kind of a proposed approach for a multi-system approach that has been repeatedly founded over time, and it has been given credibility due to the success that has been seen in tobacco control frameworks and public health frameworks to kind of approach issues that are multifaceted and systemic from a multi-layered approach from different industries, different sectors, all looking at it in the lens that they can bring and what they can bring to the table. So this is kind of historical in the sense that urban planning and public health have always kind of converged and diverged over different points in time. Urban planning kind of got its start in redesigning sanitation systems after a cholera outbreak in the late 1800s. And so it's had this influence on our systems, these really intense mass world events tend to be triggers and catalysts for these industry changes. And so I talked about COVID in that was a really big event within our lifetimes that I don't think any of us anticipated seeing, and how we can use that and use that window as an opportunity for this collaboration to take place. Next slide. And so in terms of what we can do, so at this crossroads, it's important to define roles to address the issue. And so I'm going to transition into discussing what exactly it is as a planner that can be done to build upon the work and progress the tobacco prevention efforts that have already been made. Next slide, please. So in research and in conversations, planners have expressed the need for additional guidance on what features of an environment that they are responsible for designing that also impact health and well-being, and how exactly they do so. So I'm going to attempt to illustrate a little bit briefly about what that kind of looks like. Next slide, please. So when asked about the inclusions of public health policy in general plans, planners have expressed that need for additional guidance and actionable steps that are also reasonably able to be implemented within the work of practical general plan and the scope of work of a planner. And so in outlining these tangible steps, that's the ultimate question that we're attempting to address. So one of the concepts that's essential to the knowledge base is that we have to, as public health professionals, inform planners of the associated downstream impacts from decisions made when allocating land use designations or working to develop multi-unit housing units, designating smoke-free outdoor spaces. Planners should be aware of the data that substantiates the disproportionate impacts that commercial tobacco has historically had on specific communities. And so that includes informing of a land use designation that, the example I gave earlier about how a land use designation and allowing a tobacco permit to go through has outcomes affiliated with having more tobacco retailers within a proximity or vicinity, closer to youth, schools, areas where people are already experiencing civic disengagement and divestment. And so especially for those at-risk communities, those poor health outcomes that result are further impacted by this lack of community cohesion. And so that's a really important takeaway message to kind of give to everyone, but especially those that are really involved in building the built environment. Next slide, please. And so in kind of defining roles, I alluded to downstream impacts. One of those things is tobacco retailer density. And so this involves the higher concentration of tobacco retailers found within that proximity to schools and lower income neighborhoods. Those are already priority populations, as we mentioned, that the tobacco industry is targeting. And not only that, it increases their likelihood that they would begin and initiate tobacco use and then be addicted for life. And data suggests that these areas have also had even more lax enforcement of, like I said, the flavored tobacco ban, checking IDs before sales, and also selling tobacco products for cheaper price points than would be available in communities with a higher median income. So all of these factors kind of contribute to a likelihood that someone would start engaging in a tobacco use behavior to cope with uncomfortable feelings such as mental health, economic stressors, amongst many, many other triggers. And so kind of removing the ability to access the tobacco readily and by instituting bans on the flavors, making it less desirable, making it less enjoyable to consume, addictive once you've started, as well as the economic feasibility to get it in the first place. So this goes back to that example that I used earlier about land use designations and kind of the role the planner plays within that as a framework, and understanding the impacts that happen downstream from a land use designation is really important. So while the intent might be there to create a opportunity for nutritious food within a food desert, if you also allow that business or to get a tobacco retail license, now essentially you've introduced another issue into the circle that we were originally trying to fix. And so keeping and being cognizant of that and keeping that in mind is super important. Next slide. I also wanted to talk about some housing opportunities. And so smoke-free housing is an opportunity to incorporate some tobacco prevention frameworks into the housing element for general plans, for example. And so what that kind of looks like is that we would partner with you as a local lead agency, and pursuing those partnerships is super important for planners and the local lead agency to kind of prioritize in order to provide the information for the smoke-free housing. Because a lot of times the response is that, well, how can you tell people that you can't smoke in your own house? Well, in 2018, HUD essentially released a regulation that said that in all public housing, they needed to be smoke-free. And within that kind of legislation is this understanding that smoke-free multi-unit housing impacts other people even within the space of your own home. So engaging in a behavior like smoking is going to impact other people naturally who are also living there. And it's actually a protected right to have clean air rather than a protected right to engage in smoking that's been designated by the World Health Organization. And so these are some really important talking points that can be found within resources that are available at your local lead agencies. And so contacting your local tobacco projects. There are actually a lot of funded projects through the state that have access to a ton of resources that are able to help planners within this process. So it's not reinventing the wheel, which is a phrase that we like to use pretty often, especially in public health. And it's very applicable here in that this work has already been done and has been ongoing for many years. And so it's going to continue to move in this direction of collaboration and in that it needs to have a partnership, and emphasizing that partnership is super important for us as a local lead agency for tobacco control, asking for planners' involvement in our work, and as well as, you know, prioritizing what exactly it is a planner can do within their scope of work. Next slide. So like I said, this is a resource that we can provide as local lead agencies. And so this information that I'm presenting today, a lot of the data that I've presented is from the Public Health Law Center. And so you've maybe seen this repeated theme of identifying opportunities of innovation to inject this work in the general plan, and might be wondering, like, what's actually feasible? What does this look like in other areas like mine, or what the evidence is that supports this? What are the talking points for counter arguments? So I wanted to show these are general plan inclusions for the city of Coachella, which is in Riverside County. And these are policy inclusions for smoke-free environments and healthy homes that cater towards smoke-free communities. And so these are resources that are available through your local lead agency as well, because we have access to databases that will allow you to see, you know, local policies as well as policy tracking efforts for tobacco retail and tobacco smoke-free policies within your jurisdiction. So you kind of are able to take a pulse on your community in specific, and then know where to go from there in consultation with your local tobacco projects and partners. Next slide, please. I also wanted to mention this resource. So annually, the American Lung Association releases report cards for the state, but each individual county also gets a report card, and they are scored based on a variety of different components, including flavored tobacco, smoke-free outdoor spaces. And so this is a really great resource to look up every year to see the progress that's been made in your communities. It is also broken down by cities. And so this is a great resource to kind of use to see what is the current state of affairs within your community. Next slide, please. So I talked about the role that the planner plays, but I also wanted to talk about the role briefly what a public health professional plays, because I think it's important for both to know their designations within this process. And so everyone can be kind of working efficiently and have their own cogs in this well-oiled machine. Next slide. And so, like I mentioned, as the tobacco prevention and advocacy kind of hub, as a local lead agency or as a tobacco prevention program, one of the biggest strategies and one of the biggest, you know, opportunities that you can provide for planning departments is to improve stakeholder awareness and improve that awareness in a sense that is applicable to the work that is being done. So while it might not be relevant for a planner to know intricate details about, you know, cessation within communities and strategies for cessation practice and things like that are also related to tobacco control, finding the evidence-based strategies, like I mentioned, that most people, for example, are actually in favor of a smoke-free policy within a multi-unit housing designation. And that might not be known unless you present that statistic that 70% of people are actually in favor of this multi-unit housing being smoke-free. So making sure that we're presenting statistics and data that are actually relevant for the planner's use is very important, as well as providing those resources and toolkits that we have at our fingertips are very helpful in being able to even spark ideas and being able to paint that picture for how a planner can involve themselves in this work. All right, next slide. I also wanted to briefly touch on the fact that planning is a difficult job. It is politically motivated, it is politically influenced, and the understanding of that as a public health professional is very important, because understanding that only 16% of Americans felt confident in the federal government's ability to do what was right in a survey that was taken in 2023, and a common feeling that is kind of expressed amongst planners is feeling like the local face of government. So that's a very intimidating and also scary, daunting task to take on, to ask for an advocacy from people who didn't sign on for an advocacy role. And so it's really important to designate as a public health provider, that planners are not necessarily going to be advocates for this movement. They don't necessarily need to be, championing it at every turn. However, the role that they play is very nuanced in that they can publicize those best practices and success stories and allow them to see how that's replicable in their own jurisdictions. And so that's really important to kind of designate. And I kind of wanted to turn it over here now to Amber, and let her present about the approach that was taken in seeing this in rural communities. So Amber, you're on.
Thank you. Let's see, I think I'm going to actually use my slides so I can see my notes. So I think, Miguel, if you stop sharing. And
So yours now.
I think I have it. All right, so you all can see my slides
Yes,
and not my notes.
not your
All
notes.
right, thank you. Well, thank you, Neveja. That was very informative and perfect to introduce our project. So as Miguel said, I'm Amber Weir, Project Director for NorCal for Health. So we are a competitive grantee of the California Tobacco Prevention Program. So like your LLA, we also work in educating and trying to assist community in prevention for nicotine and tobacco initiation and dependence. So my project serves the upper north coast of California, Del Norte, Humboldt, Mendocino, and Lake counties. And these are pretty remote rural regions of the state of California. So as you might imagine, we have a lot of predominantly conservative beliefs, libertarian kind of views, and not always supportive of passing more governing policies. So when we came into this work, kind of that background of Small Business Development Center and connection with a lot of these economic prosperity, people that really worry about economics, was really actually pretty powerful in the work that we decided to do in that community education and advocacy piece that Neveja is talking about. Building that trust with a group of people that are influencers, that are the ones that are voting whether or not we want to put these policies in planning documents and then move forward with those types of policies, was really important. So we started our work in joining chambers of commerce, sitting at the table, the boards of these economic groups, and talking at economic summits about the importance of health and economy. So luckily in 2019, the Surgeon General put out oops, I just hit slides. Well, the Surgeon General put out a Community Health Equals Economic Prosperity report, tying businesses to community health and helping them understand the importance of that in their success. So we use that as kind of a launching block, and this is kind of our flow of how we went out in community to talk about tobacco prevention and why health is so important to these policy leaders and economic development leaders in these communities. So we started with the CHEP, and then we went into talking about the 3450 rule or condition. That is, and I'll go into more detail with each of these in the next slide. So we talked about how our health is an individual choice. Oftentimes, what happens in our health are based off of individual choices that we make, and that how community molds those behaviors of our choices with our built environments. And then we move into why planning documents are so important in forming those built environments and those choices that we ultimately make. So, and then working with planners to put the right language in those plans. So first, we'll dive a little bit more into the case. So, being that face and trying to develop that trust in community, we did a lot of these presentations, and this is something that we gave in much more detail at like economic summits, talking about the cost of poor health and the business's bottom line. Up at the top, you see the 3.9 thousand is the average cost. And this is like back in 2019. So these are old numbers. I can't imagine how they've multiplied since then with inflation. But it cost an employer roughly $3.9 thousand per employee for the cost of their poor health. When you broke that down in the study and they looked at employees that smoked, it actually cost them on average $6,112 per employee. So this kind of detailed information, kind of helping business leaders at the table. And by the way, when we talk at economic summits, that's where all of our policy and our supervisors, our city council members, they all love to attend those meetings. So these were great points to insert and get into their awareness on supporting why policies are important to put in these documents as goals and objectives. So, but for our businesses, the cost of healthcare expenses go up. There's higher disability rates. There's presenteeism, which is working while sick. And so if you want a competitive business and everyone's showing up with colds or COPD or out on sick leave, you're not as competitive as your competitor that has healthy employees. So the importance of healthy community and employees and people, we tried to really emphasize. Then we would move into this conversation of the behaviors, the 3, 4, 50. So there's 3 behaviors. I think you guys are probably familiar with this, but it's really about how much we move, what we eat, and whether we use tobacco or nicotine products. Those 3 conditions or choices that we make then lead to 4 main diseases, which is cancer, heart disease, stroke, diabetes, and lung diseases like COPD. Those 4 diseases, when you look at your public health statistics, account for roughly 50% of the deaths in communities. So in the state of California, in your actual cities, if you can track those numbers, they're typically around 50% the cost. So preventable deaths, these are deaths that are caused by the choices and that we make. So then we would move that into conversations about, well, how do we mold those choices that we make in our behaviors? And we did a campaign talking about the shape we give our community in turn shapes us, and giving examples like smoke-free housing, thriving local economy, with how our land use and our retail spaces are safe parks and playgrounds that are also smoke-free, easy to access, walk to, access to good food, and healthy storefront ads, and not using advertising that is predatory, actually. So that chip that we talked about, the community health equals economic prosperity, also showed or linked that 80 to 90% of health outcomes are the result of conditions in communities. So we tried to use facts, and we tried to make people understand that we're here in community and talking about this as well to create a little more trust. And then we moved into, well, if those conditions, how do we work in that? And we work in that through general plans and setting. Community impact is through policies. So a lot of times public health is working in that bottom of the stream with medical interventions, services, and individual impacts. So we talked about how we need to move upstream, and it costs less money if we intercede before the issues happen. So we gave examples similar to what Nebeha was saying with some of the language. For instance, we worked with housing elements, and we're able to get some goals and policies set against providing smoke-free housing, as you see there on the right-hand side. And then in health elements, we ended up working with the city of Arcata, actually. is a very small town in northern Humboldt County, and they were doing their safety use element. And I called the city planner up at the time and said, introduced myself. And this, I think, was the first time she's ever had someone from public health call and say, how can I help with your general plan update? And she's like, well, we're doing the safety element. So we talked a little bit about that. And then she invited me to a stakeholder meeting where I could share some of the statistics that I just shared today. And then to some of their public workshops where I was able to share again in community some of those same topics. And I was also able to introduce her. At the time, our technical support, instead of Public Health Law Center, we had Change Lab Solutions. So we introduced the city to Change Lab Solutions that could also take a look at their general plan and see where they could intersect some health elements into that, or objectives and policies and goals for them. After that dialogue, they ended up deciding to create an entire health element, which is an optional element. You're not forced to do that. And many jurisdictions don't have money to do that. But with the collaboration of our program and Change Lab Solutions, they felt it was imperative actually for the development of the other elements in their general plan. As they go through an update, they will now have this health element to reference why they're setting these goals and objectives in all of these other elements. So it was a nice way to weave and intersect some of that work. So in this picture, there's just kind of some of our process is, we would submit public comment, written public comment. We would take a look at what the element was or is at the time, and then make suggestions and citations on why that suggestion is supported and why that would be a good change for the update. So that was kind of our work, and we had a lot of success with the city of Arcata and housing elements, and getting to speak with the actual policy leaders in community to gain their support, and unanimously pass these health elements and updated general plans. So quick and simple. Here's my information, and I'll be available afterwards to answer any questions that you may have. I'll hand it back over to Nabiha. If I can stop share. Here we go.
Thank you so much, Amber. And then I'm just going to close this out really quickly with a brief kind of overview of some progress that we've made close to home in Riverside, working with the Tobacco Control Project. Miguel, if you could share your slides, please.
While he does that, Nabiha, we do have one question in the Q&A for if we have some time at the end.
Yeah,
Sure.
would you mind taking that while I'll find my slides?
Sure. So the question is, and I believe this is for you, Nabiha, is do you think the frameworks can work with smoke-free tobacco-less products, Zine, vapes?
Maybe I could have some clarification. For the smoke-free housing, is that what we're referring to for the smoke-free outdoors?
It doesn't say it, and it's the anonymous. We can't see who's
Oh, okay. I'll address it from the smoke-free housing and outdoors and kind of the secondhand smoke perspective. I think the frameworks do, and they do allude to the fact that it's mostly the issue of inhaling a substance that you didn't necessarily agree to inhale. And so the smokeless and the newer flavored tobaccos they still have the smoke issue. Regarding the use of the Zyn and the alternative means of tobacco and the oral forms of tobacco, I think that because they are so new, the policy work needs to be different. And so combating those might look more along the lines of reducing retail licenses and proximity buffers, school buffers, and going through that means and that strategy. So there's a few different lenses to kind of view it from and strategically approach it. And my best suggestions would be to partner with your local jurisdictional tobacco project, like I'm going to talk about now, because there are a ton of resources that they can provide that are also tailored for your specific community and your specific population demographics and what that might look like and what that approach might entail. So speaking of which, in conclusion, next slide, please, Miguel. I wanted to kind of touch on the successes of the RUHS Public Health Tobacco Control Project. And so we've had success in having Latino community members basically spearhead the campaign to pass the smoke-free multi-unit housing policy in the city of Riverside. And so now multi-unit housing establishments within the city of Riverside are designated to be smoke-free. And so the right to clean air and the right to breathe clean air is now a protected right, as it should be and as it has been designated by the World Health Organization, rather than the autonomous right to smoke. So that was a great success. I also wanted to highlight one of our corner stores, a corner store conversion that committed to eliminating the sale of tobacco and alcohol. In about 2016, they were awarded a grant along with Kaiser Permanente, and that helped to create the East Side Heal Zone. And so within this community that this corner store is located in, they were seeing a lot of chronic disease outcomes such as obesity and higher smoking rates, and it is a primarily Latino population. And so along those lines of the same statistics that I was presenting earlier, that basically is the prime demographic that's targeted by tobacco industries. And so in an effort to put their community first and wanting to make sure that they are putting the community above all else, including the bottom line and the financial risk that it might be to eliminate the sale of tobacco, they still committed to it, and they completely outright stop selling it and instead have used the sale for nutritious fruits and vegetables and refrigeration that the grant was able to provide for them that supplement those costs that they would have gotten from tobacco instead. And they also have an on-site restaurant that they use to supplement those costs. So really elevating those real life examples is super important within our communities. And so that's why we're exploring the different perks that can come with commitment like that, whether that be some sort of doctrine from the county or some sort of basically elevating their establishment, like a list of establishments that have committed to this approach. Next slide, please. And so we also use the arts in this approach, and I wanted to kind of highlight the importance of the arts as a new kind of transitional pathway that we're taking into having really tangible and poignant statements made that are memorable. Making sure that the information that we are giving is something that isn't just going to disappear and is something that is going to remain in the memory, is something that is critical in terms of memory and also in terms of just learning outcomes and implementation. And so using the arts to do that is a really important and distinct way to make sure that everyone is remembering your message because it elicits a positive impact in our brains. And I wanted to leave you with this quote. Next slide, please. That we cannot become what we want by remaining what we are. And so multi-generational work is not done in one general plan cycle or one grant-funded period. And this kind of is alluded to the fact that we need to partner with many organizations and as many people as we can in order to further that work and make sure that these unprecedented times and these innovative approaches are effective in solving the issues that our world is facing today. And we're promoting collaboration within that. Thank you.
Thank you, Nabiha. That was great. Miguel?
Yes, thank you so much, Nabiha and Amber. Excellent presentations. A lot of great content for our audience to consider and also contacts to where they can reach out to learn more about these opportunity of integrating tobacco control policy into planning processes. I was wondering if there's any additional questions from the audience. I know one of them was already addressed.
And
So
while we're
go
kind of
ahead, Nadia.
oh, sorry. Thank you so much, Ryan. I was saying while everyone's kind of coming up with questions, I wanted to have this pop-up question as well. So a short answer, what is something new that you learned today? If everyone could fill that out.
Well, everybody is filling that out. We do have several attendees. So if you want to put your question in the Q&A, or you can also raise your hand and we can allow you to ask your question live.
And we can also welcome comments and reactions and impressions, particularly from those planners who answered that they knew very little at the beginning of the webinar. Maybe I can put Robert on the spot. See, he's a planning leader in the city of Moreno Valley. What are your thoughts?
You know, planning is like Nabihe said, a relatively new profession, but there's already a lot of different aspects to planning that we deal with. As you know, speaking from a public planner's perspective, tobacco and tobacco policies has not been something that has been in the forefront of our minds. Public health has, because folks like Planners for Health and your counterpart up north are pushing those policies forward, and we're starting to see them more. But when I saw this training come forward, I did want to attend because I thought it was interesting and I wanted to see what it is that is being done. Now, what I will say is that from a public planning perspective and updating general plans and things of that nature, there's a lot of constraints to try to implement it. So I think that working with Nabiha and everybody that's been working on this effort would be ideal to figure out how we can incorporate it, because you have budgetary constraints, you have staffing constraints, and there's already statutory requirements on the general plan that we need to meet. But this is also an important topic, so we have to figure out how to get it in our general plans and figure out how to resolve those issues. So I think it's very interesting, and I might be reaching out to you all to get more information.
Thank you so
Great
much,
presentation.
Robert. And I see a question from Mark Collins from the city of Temecula. He's asking, what have been the challenges of enforcing smoking regulations outdoors in dense mixed-use areas? Who would like to comment on this one?
I can briefly comment on it. So the challenge obviously being that it's very hard to tell people what they can and can't do, especially in outdoor areas that are common and have mixed use designations. And so the kind of the approach that I've seen for this is that making sure that it's not necessarily smoke free everywhere, and that there are designated spots for the smoking to occur, and make sure that those spots are away from and are taken into consideration, being around children, the areas that are, the airflow is less because of the building, logistic issues like that. So making sure that those are all taken into account. And I think looking at a very microscopic level is the best way to kind of try and account for those issues. But I agree, there are always little, little things like that are very difficult to try and completely blanket enforce. And so as it's implemented, there's going to be stuff that comes up that has to be addressed, and that's one of those things.
Thank you, Nabiha.
I can add to that.
Go ahead.
Working in public health and working on having the funding from California Tobacco Control Program allowed us to pay for signage. And we did signage in creative ways like the sandwich boards and the lawn signs for special events. Our city we gave them like 500 sandwich boards, maybe it was 200 sandwich boards, and they put those out as like road closure, the dual use to remind people that these are smoke-free events. And we actually, like all the soccer fields and the parents that were smoking, we actually have parents now that are feeling safe enough to go out and say, hey, this is a smoke-free event, because there's those signs right there too. So it's always a challenge. I think enforcement's always a challenge. And I think creative ways of creating community support around it is really very important for enforcement.
Thank you so much, Amber and Nabija. I think we are at the top of the hour. So perhaps this would be a good time to wrap up our webinar. And I would like to ask both of you, Nabija and Amber, if you have any last comment or message that you want our audience to take away with them.
Yeah, in the chat, I believe we just put a link to a survey that we would really appreciate if everyone could fill out. It helps us out in terms of how to improve and how to, takeaways from this. But my main takeaway that I hope that everyone got was how important it is to collaborate, how important it is to partner with your local tobacco projects and agencies, especially in a work that's as nuanced as this.
Thank you, Nabija. How about you,
That would be
Amber?
my hope as well. It's always interesting having to work in a new field that you're not familiar with, and we're not all familiar with it as well. And so being able to brainstorm together really actually was pretty fun, to be creative and figure out new ways to address these issues. And I just also want to support that. Although some people, we put these policies in these documents and people think nothing ever happens from that, they are happening. And in the last 5 years in our rural North Coast, we've passed 7 policies with tobacco retail license and smoke-free housing and smoke-free parks. And a lot of that has to do with these kinds of community conversations, these nuances in creating policy leaders that are educated about this and why it's so important. So your work really helps informing our community and our personal choices in health.
Excellent. And with that, please help me thank our speakers today with a round of a virtual applause. Well done. Thank you so much. Thanks everyone for joining today. Stay tuned for more programs in 2025. And on behalf of Planners for Health California and Planners for Health Inland Empire section, I thank you again for your attendance today, and please stay in touch. Thank you so much and have a wonderful day. Goodbye.